An update on the COVID-19 situation here. 136 new locally transmitted cases were confirmed today.
Out of the 81 linked cases, 36 are traced to the Jurong Fishery Port Cluster and 2 to the KTV cluster. There were also 3 imported cases reported today. More details will be released later tonight.
Possible easing of the current Phase 2 heightened alert restrictions for vaccinated people by early next month, as well as quarantine-free travel for returning travellers who are vaccinated.
Well, these are some of the nation's next steps in managing the pandemic shared by the 3 task force co-chairs in Parliament yesterday.
Let's recap the key points. In early next month, the midpoint of the P2HA period, restrictions will be reviewed and some curbs may be eased if the situation is under control. Any easing, though, will be extended only to vaccinated people.
And come September, when about 80% of the population are expected to have been fully vaccinated, further easing may take place, including quarantine-free travel for returning travellers who are vaccinated. Moving forward, Health Minister Ong Ye Kung said Singapore's healthcare protocols must be remodelled as we prepare to live with COVID-19, like a greater use of community care facilities, shorter stays at these facilities and hospitals, and home quarantine.
Let's talk more about this with Professor Teo Yik Ying, Dean of NUS's Swee Hock School of Public Health. Welcome back to the show, Professor. We've seen a lower number of cases linked to the Jurong Fishery Port and KTV clusters compared with last week. But MOH reported 10 new clusters yesterday. Professor, how would you assess our current situation?
Thank you for having me back. So indeed, while the number of cases reported daily is still above 100, Singapore is actually in a much better state to handle these infections than, say, 6 months ago. And the reason is the vaccination of the people in Singapore continues on a healthy upward trajectory, where we have now around 55% of the population fully vaccinated and around another 20% having received their first dose. So we see that there are new clusters emerging daily. And that is very much a sign that the virus is still going about in our community. And because we have more and more people vaccinated now, some of these people may be infected, but because they have no symptoms or they have very mild symptoms, they themselves may not even know that they are infected and they still move about outside home. And this is the reason why we continue to see new clusters and also new unlinked cases as well. So if you ask how we are doing now, my answer is actually not to look at case numbers alone or even the number of clusters, but also where the infections are happening. Are they affecting children under the age of 12 who are still unvaccinated to the point that we see children infecting each other in schools, tuition centers, or at playgrounds? Are there more and more people who, because they were infected, that they now need to go into hospital to seek care? And I think based on some of these indicators that I mentioned, I actually think that the COVID situation in Singapore at the moment is one that is actually under control. But as I mentioned, we should continue to monitor whether the transmission chains are now entering the schools or other environments where children are in, as well as to really monitor our hospital situation carefully to make sure that there is no rising trend in the demand for limited resources such as oxygen or high dependency ICU beds.
Right. Well, let's look ahead to early August, Prof, the midpoint of this Phase 2 heightened alert period when a task force will review the rules. Do you think we are on track for some sort of easing?
So if we look from the basis of only just daily case numbers, the number of unlinked cases or the number of clusters like we talked about earlier on, then people would be wondering, why are we talking about easing the rules? But actually, when we look at the perspective, from the perspective of vaccination numbers across the whole of Singapore, the number of infected people who actually develop serious disease and require hospital care, and most importantly, if we also look at the signs of the vaccination, what it is telling us right now, I actually think that Singapore is in a very good position to start thinking about easing up our restrictions. And I mentioned the signs of vaccination as one of the most important factors. So let's perhaps just remind ourselves what exactly vaccination means, because I think there is still a lot of confusion and misunderstanding that's going about. So being vaccinated with the vaccines we have in Singapore from Pfizer and Moderna will significantly reduce the chance of a person being infected. It doesn't completely prevent a person from infection, but vaccination means that it makes a person less likely to be infected in the first place. Now, based on real world data from Singapore and other countries, we know that if a vaccinated person does become infected, he or she is actually much less likely to develop severe disease to the point that require hospital care or even more serious complications that require oxygen or ICU beds. And we can see this in today's news that out of the 18 people who require oxygen, 9 were unvaccinated and 9 were only partially vaccinated. None of those that require oxygen or in ICU were fully vaccinated. So vaccination really does protect a person by first lowering the chance of being infected, and second, lowering the chance of disease and severe complications if you do get infected after vaccination. So coming back to your question then on whether we are on track for some easing of the rules, the science tells us vaccination is able to reduce COVID-19 to something that is mild or even with no symptoms and with no short-term or long-term impact on our health. So actually by mid-August, I expect we will have more than 70% of our people fully vaccinated, maybe even 75%. And this puts us in a very good position to ease our restrictions in phases, not all in one go, but I do expect we will be on a path to regaining some of the freedom we had lost because of COVID.
Professor, casting further into the future when COVID-19 is endemic, one thing that Minister Ong brought up was the remodeling of our healthcare protocols. What do you think our healthcare system would look like? And do you think this remodeling would go beyond COVID-19 care?
So actually, Singapore's healthcare system has always been structured in a way to be resilient against surges while relying on the most up-to-date scientific evidence and data. So I'll use an example. Last year, when it was spreading very quickly within the migrant worker dormitories, we were seeing more than 1,000 new cases reported every day. But we used the science that young, healthy people, when infected, most of them have very little symptoms or even no symptoms. So we didn't need to put these people in our hospitals. So instead, we house them in community care facilities. We rely on the use of oximeters to monitor these low-risk cases for any signs of worsening symptoms. And what that meant was that it allowed us to ring-fence our acute hospital beds for the high-risk COVID cases, as well as other non-COVID related needs. So looking ahead, especially with more people in the country vaccinated, I expect people who are infected are mostly going to be with mild or no symptoms, and that is the vaccine working to protect them. And in this situation, there's no need to house these people in hospitals if we have a way to monitor them, perhaps with the household distributed oximeters. They can self-isolate at home. And this is exactly why we are also switching tact to track the situation in hospitals. Now the numbers are not just the daily numbers of infected cases, but we also look at the number of infected people in the hospitals with severe complications that needs oxygen or even in high dependency or ICU care. So the data locally and internationally suggests that those requiring more severe hospital care or even dying from COVID-19 are much more likely to be those that are unvaccinated. So we may see some healthcare protocols changing to differentiate between vaccinated and unvaccinated people, but clearly without compromising on the quality of care and the health outcome for anyone, everyone. So instead of going all out to track every single case, we may switch to what we currently do with influenza, which is to perform some form of surveillance in the polyclinics where we selectively test people coming into the polyclinics so we understand what is the scale of the COVID-19 problem in the community and what are the circulating or dominant strains. The rest of the time, we may actually ask people to just test themselves or to isolate at home when in doubt. So clearly, there will be other ways that we will remodel the way we handle COVID-19 as a healthcare system. But the above are just some of the examples which I expect will be considered, perhaps not just in Singapore, but for any country that is able to deploy sufficient amount of vaccines to their people to treat COVID as endemic and to live with COVID.
Well, as always, thanks so much for your time and insights, Prof. We've been speaking with Professor Teo Yik Ying, who's Dean of the Swee Hock School of Public Health at NUS.